Hey Alpha Nurses, I'm Nurse Sandra from alphanursegap.com. This is NCLEX Next Generation Case Study number 1. As you might be aware, NCLEX will be changing in April of 2023. They will be adding new types of questions such as case studies. The old NCLEX type of question will still be giving on the NCLEX, but they're just adding new styles of questions. I will probably do more of these questions as time go on because I think most of you watching this video will be taking the new NCLEX. Let me know in the comment section which test you'll be taking. Anyway, you can get my study guides on Etsy. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
NCLEX Next Generation Case Study 1. The nurse reviews the medical record of a 56-year-old client who was recently admitted to the emergency department. Nurse's Note, page 1. The spouse brought the client into the emergency department after finding a self-deletion note and the weapon cabinet unlocked. Reports that the client is not the same person after being hospitalized 3 months ago with a severe RSV infection and being mechanically ventilated for over 2 weeks. The client states that since being discharged from the hospital, they have periods of heart palpitations, insomnia, apathy, depressed mood, and anorexia. They report that drinking alcohol every night helps to relax, but still becomes anxious and depressed at times. Nurse's Note, page 2. They are very worried about getting RSV again because the client's sibling, whom the client recently visited, tested positive yesterday. They have nightmares about the hospital experience because the client nearly died. They lost 35 pounds during the hospital stay, but states they still weigh more than 260 pounds. They were considering self-deletion this evening because the client was afraid of possibly being reinfected and dying this time. They were recently diagnosed with type 2 diabetes mellitus, controlled by diet and metformin. Nurse's Note, page 3. The social worker interviewed the client and administered several screening assessments for selected mental health conditions. The client admitted to flashbacks about hospitalization and feels guilty about putting their family through that experience. They stated that they were lazy and did not take precautions. As a result, the client developed an RSV infection, which worsened and led to the hospital stay and mechanical ventilation. They expressed remorse for upsetting their spouse and apologized to her and the social worker. Question 1. The client most likely has blank as the primary potentially life-threatening mental health condition, as evidenced by blank and blank. The priority for the client's care is to blank. Options 1. Personality disorder. Dissociative identity disorder. PTSD. Clinical depression. Options 2. Anorexia. Excessive worry. Nightmare. Flashbacks. Options 3. Begin intensive counseling. Ensure personal safety. Start drug therapy. Refer to a spiritual counselor. The correct answers are PTSD, nightmare, flashbacks, and ensure personal safety. Rationale: since surviving that experience, the client developed new emotional and physical behaviors. 2 of the classic differentiating behaviors associated with PTSD, and not with other mental health conditions, are nightmares and flashbacks. Excessive worry and anorexia are associated more with anxiety than with PTSD. The client is at risk of self-deletion because the client was planning how to end his life, therefore, the priority for the client's care is safety. Once safety is ensured, the client may start drug therapy, begin counseling, and/or need a spiritual advisor. Question 2. The client was diagnosed with PTSD, anxiety, and self-deletion risk. Which physician orders would the nurse anticipate for the client at this time? Select all that apply. A. Begin antidepressant drug therapy. B. Admit to acute psychiatric unit. C. Refer to case manager. D. Refer to spiritual advisor. E. Begin intense psychotherapy. F. Place on self-deletion precautions. G. Limit visitors to immediate family. The correct answers are A. Begin antidepressant drug therapy, B. Admit to acute psychiatric unit, E. Begin intense psychotherapy, F. Place on self-deletion precautions, and G. Limit visitors to immediate family. Rationale: the desired outcome for this client's care is to ensure safety because of potential risk of self-deletion. The orders would be focused on ways to keep the client safe, including admission to the acute psychiatric unit for one-on-one observation and treatment with medication and psychotherapy. Immediate family members could provide support and encouragement for the client during the hospital stay. A case manager would not help ensure immediate safety. A spiritual advisor may be requested by the client but is not usually ordered. Question 3. The client was prescribed sertraline and started on psychotherapy. Select 5 statements that the nurse would include in the health teaching about sertraline. A. This drug is one of the most effective ways to treat PTSD and depression. B. We will be monitoring you for sedation effects while you are here. C. Let me know if you have trouble urinating or having a bowel movement. D. Let me know if you have trouble sleeping or feel nervous while on the drug. E. We will be monitoring you carefully for changes in your vital signs. F. You might experience mild nausea and feel agitated when you start this drug. G. Your liver and kidney function will need to be monitored by lab testing. The correct answers are A. This drug is one of the most effective ways to treat PTSD and depression. D. Let me know if you have trouble sleeping or feel nervous while on the drug. E. We will be monitoring you carefully for changes in your vital signs. F. You might experience mild nausea and feel agitated when you start this drug. And G. Your liver and kidney function will need to be monitored by lab testing. Rationale: sertraline is a selective serotonin reuptake inhibitor that can be very effective in managing clinical depression and/or PTSD. Side effects of the drug include insomnia, nervousness, anxiety, agitation, and mild nausea. This drug can affect liver and kidney function, which should be monitored through frequent lab testing. The nurse would monitor vital signs to help assess for a rare adverse drug reaction called serotonin syndrome. Symptoms include elevated temperature, heart rate and blood pressure, delirium, muscle spasms, and abdominal pain.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.